Biochemistry for nursing. Carbohydrates, digestion, absorption, and metabolism, MCQs 115. 1. The major site of carbohydrate digestion is A. Stomach, B. Small intestine, C. Oral cavity, D. Large intestine. Answer B. Rationale. Pancreatic amylase acts mainly in the small intestine. Chahert 2. The end product of starch digestion is A. Lactose, B. Glucose, C. Fructose, D. Galactose. Answer Rationale. Starch is ultimately hydrolyzed to glucose. 3. The enzyme absent in humans for cellulose digestion is A. Maltase, B. Sucrase, C. Cellulase, D. Amylase. Answers Rationale. Humans lack cellulase, so cellulose is indigestible. 4. SGLT1 transports glucose across intestinal mucosa using A. Passive diffusion, B. Dependent active transport, C. Facilitated diffusion, D. Endocytosis. Answer B. Rationale. SGLT1 uses sodium-dependent secondary active transport. Fructose is absorbed via A. SGLT1, B. GLUT2, C. GLUT5 pump. Answer C. Rationale. GLUT5 specifically transports fructose. The major storage form of carbohydrate in humans is A. Lactate, B. Starch, C. Glycogen, D. Cellulose. Answer C. Rationale. Carbohydrates are stored as glycogen in liver and muscle. 7. Glycolysis occurs in the A. Mitochondria, B. Cytosol, C. Nucleus, D. ER. Answer B. Rationale. All glycolytic enzymes are cytosolic. 8. The first step of glycolysis is catalyzed by A. PFK1, B. Hexokinase, C. Aldolase, D. Pyruvate kinase. Answer B. Rationale. Hexokinase phosphorylates glucose to glucose 6-phosphate. 9. The TCA cycle occurs in the A. Cytosol, B. Mitochondrial matrix, C. Nucleus, D. ER. Answer B. Rationale. TCA enzymes are located in the mitochondrial matrix. The Cori cycle involves conversion of A. Glucose to glycogen, B. Pyruvate to acetyl-CoA, C. Lactate to glucose, D. Fatty acids to glucose. Answer C. Rationale. Lactate from muscle is converted to glucose in liver. 11. Gluconeogenesis occurs mainly in A. Kidney only, B. Muscle, C. Liver, D. RBCs. Answer C. Rationale. Liver is the primary site of gluconeogenesis. 12. The major source of blood glucose during fasting is A. Dietary carbohydrates, B. Glycogenolysis, C. Lipogenesis, D. Cholesterol transport. Answer B. Rationale. Glycogen breakdown maintains glucose initially during fasting. 13. The hormone that increases blood glucose by stimulating glycogenolysis is A. Insulin, B. Glucagon, C. Estrogen, D. Thyroxine. Answer Rationale. Glucagon raises blood glucose by glycogen breakdown. 14. Insulin promotes A. Lipolysis, B. Gluconeogenesis, C. Glycogenesis, D. Ketogenesis. Answer C. Rationale. Insulin stimulates glucose storage as glycogen. The primary fuel for RBCs is A. Fatty acids, B. Ketones, C. Glucose, D. Amino acids. Answer Rationale. RBCs lack mitochondria, so depend solely on glucose. Regulation of blood glucose, MC16 to 2S16. Normal fasting blood glucose is A. 40 to 60 milligrams del, B. 60 to 80 milligrams per day, C. 70 to 110 140 milligrams. Answer C. Rationale. Normal fasting blood glucose is 70 to 100 milligrams per day. 17. Hypoglycemia is defined as blood glucose below A. 90 milligrams per dol, B. 70 milligrams per dol, D. 40 milligrams per dol. Answer Rationale. Blood glucose below 70 milligrams per dol is considered hypoglycemia. 18. Counter-regulatory hormones include all except A. Glucagon, B. Cortisol, C. Growth hormone, D. Insulin. Answer D. Rationale. Insulin lowers blood glucose unlike counter-regulatory hormones. 19. The hormone most important in post-absorptive glucose regulation is A. Insulin, B. Glucagon, C. ACTH, D. ADH. Answer B. Rationale. Glucagon maintains glucose during fasting. 20. Glycemic index refers to the ability of foods to A. Measure fat content, B. Raise blood glucose, C. Build muscle, D. Improve digestion. Rationale. GI measures how fast a food increases blood glucose. 21. A hormone that stimulates gluconeogenesis is A. Insulin, B. Glucagon, C. Leptin, D. Oxytocin. Rationale. Glucagon promotes hepatic gluconeogenesis. 22. Insulin is secreted from A. Alpha cells, B. Beta cells, C. Delta cells, D. F cells. And beta cells of pancreas release insulin. A diabetes mellitus, type 1 and 2, MCQs 23 to 35. 20. Type 1 diabetes is caused by A. Insulin resistance, B. Autoimmune destruction of beta cells, C. Excess cortisol, D. High carbohydrate diet. Rationale. Type 1 DM involves autoimmune beta cell destruction. 24. Type 2 diabetes is primarily due to A. Absolute insulin deficiency, B. Viral infection, C. Autoimmune disease, D. Insulin resistance. Rationale. Type 2 DM is characterized by insulin resistance. 25. Polyuria, polydipsia, and polyphagia are classic symptoms of A. Hypothyroidism, B. Diabetes mellitus, C. Cushing syndrome, D. Dehydration. Rationale: these three P's are hallmark symptoms of DM. 26. Diabetic ketoacidosis DKA is most common in A. Type 1 DM, B. Type 2 DM, C. Gestational DM, D. Prediabetes. Answer: rationale: DKA is typical of insulin-deficient type 1 DM. Hyperosmolar hyperglycemic state, HHS, occurs mainly in A. Type 1 DM, B. Type 2 DM, C. Gestational DM, D. Neonatal. Answer B. Rationale: HHS occurs in type 2 DM where insulin is present but insufficient. A long-term microvascular complication of diabetes is A. Stroke, B. Nephropathy, C. Coronary artery disease, D. Peripheral artery disease. Answer B. Rationale: diabetic nephropathy is a microvascular complication. 29. Retinopathy in diabetes is caused by A. Hyperinsulinemia, B. Chronic hyperglycemia, C. Hypoglycemia, D. Low blood pressure. Answer B. Rationale: chronic high glucose damages retinal vessels. Half 30. First-line drug for type 2 diabetes is A. Insulin, metformin, C. Steroids, D. Growth hormone. Answer B. Metformin is the recommended first-line therapy. Gestational diabetes is most commonly detected by A. Fasting glucose, B. HbA1c, C. Glucose challenge test, D. Random glucose. Answer C. Rationale: GCT is the screening test during pregnancy. 32. A common acute complication of insulin therapy is A. Hypercalcemia, B. Hypoglycemia, C. Dehydration, D. Hypernatremia. Answer B. Rationale: excess insulin can lower blood glucose dangerously. 33. Insulin resistance is strongly linked to A. Underweight, B. Obesity, C. Low carbohydrate intake, D. Sedentary lifestyle only. Rationale: obesity is the strongest risk factor. 34. A characteristic feature of type 1 diabetes is A. High C-peptide, B. Low C-peptide, C. Central obesity, D. Acanthosis nigricans. Answer B. Rationale: type 1 DM has low or absent C-peptide due to no insulin production. 35. Acanthosis nigricans is commonly associated with A. Type 1 diabetes, B. Insulin resistance, C. Hypoglycemia, D. Thyroid disease. Rationale: it is a skin marker for hyperinsulinemia insulin resistance. Investigations of diabetes, MQs 3650. 36. The gold standard test for diagnosing diabetes mellitus is A. Urine glucose, B. OGTT, C. Ketone bodies, D. Blood pressure, B. Rationale: OGTT is the most definitive diagnostic test. 37. OGTT requires fasting for A. 2 hours, B. 4 hours, C. Overnight, 8 to 12 hours, D. No fasting. Answer C. Rationale: OGTT must be performed after overnight fasting. 38. In a standard OGTT, the oral glucose load is A. 25 grams, B. 50 grams, C. 75 grams, D. 150 grams, or C. Rationale: adults receive 75-gram glucose during OGT. 39. A diabetic OGT value at 2 hours is glucose off. A. 100 milligrams per little, B. 126 milligrams per little, C. 140 milligrams per little. Answer D. Rationale: 2-hour plasma glucose 200 milligrams per little confirms diabetes. 40. Mini GTT is mainly used for A. Infants, B. Rapid screening, C. Pregnant women, D. ICU patients. Answer B. Rationale: mini GTT is a shorter version for screening. 41. Extended GTT is used to diagnose A. Liver disease, reactive hypoglycemia, C. Dehydration, D. Thyroid disorder. Rationale: extended GTT helps identify prolonged hypoglycemic responses. 42. Glucose challenge test GCT is performed with a glucose load of A. 25 gram, B. 50 grams, C. 7,500 grams. Rationale: GCT uses a 50-gram glucose load. 43. IVGT is used when A. Patient has normal glucose, B. Oral glucose is contraindicated, patient is pregnant, D. For children only. Rationale: IVGTT is used when oral administration is not possible. 44. In OGT, blood samples are taken at A. 0 and 30 minutes, B. 30 and 60 minutes, C. 0 and 120 minutes, D. 120 and 180 minutes. Answer C. Rationale: standard OGTT requires fasting and 2-hour sample. 45. In a normal GTT curve, glucose returns to fasting level by A. 30 minutes, B. 60 minutes, C. 90 minutes, D. 120 minutes. Answer D. Rationale: normal glucose curves normalize within 2 hours. 46. A diabetic GTT curve shows A. Early drop in glucose, B. Rapid fall to fasting level, C. Prolonged elevation of glucose, D. No rise after glucose load. Answer C. Rationale: diabetics show delayed return to baseline. 147. HbA1c reflects average blood glucose over A. 1 week, B. 2 weeks, C. 6 to 8 weeks, D. 24 hours. Answer C. Rationale: HbA1c indicates glycemic control over 2 to 3 months. HbA1c level diagnostic for diabetes is A 5%, B 5.7%, C 6.5%, D 7.5%. Rationale: HbA1c 6.5% confirms diabetes. 49. HbA1c is defined as A. Plasma glucose level, glycated hemoglobin, C. Fasting insulin, D. Liver glycogen. Answer: B. Rationale: HbA1c is hemoglobin non-enzymatically bound to glucose. Hash 50. A flat GTT curve suggests A. Diabetes mellitus, B. Hyperthyroidism, C. Malabsorption, D. Kidney disease. Answer C. Rationale: in malabsorption, glucose fails to rise adequately after intake. Thank you. Have a nice day.